Morning. I'm Dr. Malik, intensive care specialist. Today I want to talk about an important topic that too in childhood and young people, particularly school-going children, intermediate children, degree students. This is a very common problem, especially school-going children. There is one condition called acute rheumatic fever. Acute rheumatic fever. See, when I say rheumatic, don't just jump into rheumatic arthritis or rheumatoid arthritis. Rheumatoid arthritis is one condition which adults, mainly some aged people or middle-aged people, they face. They have joint pains, stiff joints, etc., etc. I am not talking about that condition. That is not that serious condition. That needs, it has got medicines. You can take treatment for it. I am talking about acute rheumatic fever. Acute rheumatic fever. Acute rheumatic fever. It is seen in children of school age or young people, are very young people, intermediate degree, these students. It presents with throat pain, something like tonsil pain or throat pain, irritation in the throat, then followed by joint pains. Joint pains are very, very severe. For example, this joint gets involved, left elbow gets involved or left wrist gets involved. It will swell. They will have swelling. They cannot move the joint. And when it is subsiding, it subsides on its own. When it is subsiding, immediately there will be some right elbow joint or right. It is called fleeting type of joint pains. It doesn't stay at one place. It involves one joint. It causes swelling. When it is coming down, when it is automatically it will come down. Immediately it involves the other joint, for example knee joint or the right elbow joint, like fleeting type of joints. One joint to the other, one joint to the other, in body bilaterally, both the sides of the body. So it will be jumping like this. This is called fleeting type of joint pains. Very, very important. And patient can have carditis. Carditis means the heart also gets involved. Heart goes into inflammation, that is, there will be some swelling in the heart also, that is called carditis. These are the main features. Some other small features like there will be some tremors, forget about it, it is not that important. That is also a feature of this disease. So what is to be done at this stage? Throat pain followed by joint pains which are fleeting in nature, swelling of joints, etc., etc. in young people, in children and young people. So this is, first you have to get the blood test called ASO titer, anti-streptolysin O titer. ASO titer is very much raised. It is very much raised. Then it indicates that this case is acute rheumatic fever. Acute rheumatic fever. You can do heart. You can go to a cardiologist or physician to get checked. So they check the heart also, because this particular acute rheumatic fever, it will involve the heart also, and it damages the valves in the heart. I will come to it. So what is the treatment? Basically simple treatment. Penicillin, simple penicillin. There is one injection called Penicillin. Penicillin is 3 types. Procaine penicillin, nowadays not being used regularly. Benzyl penicillin, short acting. This is procaine penicillin is once a day. Forget about it. We are not using. Benzyl penicillin is every 6 hourly we use it. In some conditions we use it. And there is third insulin called benzathine penicillin, which is called Penicillin injection. Benzathine penicillin. There are some other brands also. Any brand you can take it. So Penicillin injection, 12 lakhs you should take every 3 weeks. You must, once you diagnose acute rheumatic fever, you must give the child or the young people once in 3 weeks injection. One injection for it acts for 3 weeks. So 3 weeks, every 3 weeks you must give one injection till the age of 20, 25, at least 25, so that it will not involve the heart. How the heart is getting involved in this particular situation? You know the heart. This is inside of the heart. There are 4 chambers, we all know it. The upper 2, the lower 2. Okay, atria and ventricles. So left upper atrium. What? Left upper atrium to left lower ventricle. So left atrium to left ventricle, there is mitral valve. This is mitral valve. It allows blood only to flow one side. And right upper heart to the lower heart, that is right atrium to the right ventricle, there is one valve called tricuspid valve. You have three here, there are two lifts. Here there are three lifts: mitral valve, tricuspid valve. There is one valve, Marmor valve here. This is called aortic valve, where the left side of the heart pumps blood into the aorta, big artery which supplies the whole body. So here there is aortic, this is aortic valve A, aortic valve. And right side of the heart, when the blood comes down into the ventricle, there will be a valve here between this tube which goes into the, this is this tube which goes into the lungs. So there is a small valve here which allows blood only one side. It is called pulmonary valve. Tricuspid, aortic, mitral valve, tricuspid valve, aortic valve, pulmonary valve. See, these four valves, at least one of them can be affected by this acute rheumatic fever, which is very dangerous. Once the valve is affected, the heart, inside of the heart will totally get damaged. The thing is, this valve, if it is damaged, it allows the blood supply upwards also, reverse also. So it is very dangerous. The heart goes slowly, it enlarges slowly, it goes into heart failure. So be careful about this, get it checked. Use penicillin, Benadryl injection once in 3 weeks till the patient is 20-25 years old, or at least 25 years old, little more also, till everything is okay. Once the cardiologist says, okay, you need not use now, please use it. And it can prevent the heart. Once it affects the heart, you have to go for heart valve replacement, mitral valve replacement. So they do one surgery called valve replacement is a must. So please be careful about this particular entity. Very, very, very important. Often we see this, we miss them. So normally we miss in childhood, then only we see later the heart complications. Be little cautious about this particular acute